The female reproductive system consists of external sex organs and internal reproductive organs. At birth, both internal and external genitalia are immature. However, all the eggs that the ovaries contain are highest at birth, about 1 to 2 million. After birth, the female cannot grow any more eggs. However, the eggs are not released until the development of the reproductive system, which begins after the onset of puberty with ovulation and menstruation. The vast majority of the eggs present at birth die off over the years without ever being released. Nearly a year before menarche, which is the onset of a female's first menstruation, the sex organs begin to enlarge and the girl develops secondary sexual characteristics, such as the enlargement of the breasts. The hypothalamus stimulates the pituitary, which in turn stimulates the ovaries. These hormonal changes cycle every 28 days approximately. 21 to 35 days is the range. Vaginal, cervical, and uterine secretions are produced as a result of these hormonal changes that, at the middle of the cycle during ovulation, aid in the transportation of the sperm to the waiting egg cell in the fallopian tube in order to potentially start a pregnancy via fertilization. If no fertilization happens, the egg degenerates and the woman completes her menstrual cycle a few days later. The cycle of menstruation and ovulation depends on the continuous hormone-driven feedback between the hypothalamus and the pituitary glands at the base of the brain and the ovaries, with the rising levels of one hormone tending to shut off other hormones and falling or low levels of some hormones triggering the production of other hormones. There are several important hormones in this cycling besides those mentioned here, and we will go into more detail about the menstrual cycle a bit later in this module. Editor's note: one important point about the hypothalamic-pituitary-ovarian axis is that it maintains the female reproductive cycle by complex feedback loops, and it is one of many feedback loops which you will encounter in your study of various physiological systems in the human body. The internal organs of the reproductive tract are the vagina, the uterus and cervix, fallopian tubes, and ovaries. They are mainly used for reproduction, but also for female sexual performance as well. The endometrium labeled in this diagram is simply the inner lining of the uterus. Also labeled in this diagram are the finger-like projections at the end of the fallopian tubes called the fimbriae, which help guide the egg released from the ovary into the fallopian tube. The vagina is part of both the sexual and the reproductive system. It consists of a fibromuscular tube that starts externally and ends around the cervix. It is also referred to as the birth canal because it is the exit point of the fetus at the time of birth. The cervix is the opening to the uterus or the womb. The vagina is not just a passive receptacle for the male sperm. It is sexually responsive and contracts during orgasm. It produces a variety of vaginal secretions, some of which are intended to help the sperm pass upwards to the cervix. The cervix is referred to as the neck of the uterus, as it is its narrower part. On the vaginal side of the cervix, the opening to the vagina is called the external os. The cervix is 2.5 to 3.8 centimeters long and opens into the uterus. The cervical glands secrete a mucus that, near ovulation, is beneficial to sperm trying to travel up to the fallopian tubes to fertilize the egg. The mucus thickens during infertile time. The uterus is also referred to as the womb. It is considered the main female reproductive organ as it is the receptacle in which the embryo and fetus develop. The uterus is pear-shaped and about the size of a fist. It mainly consists of muscle called the myometrium, but is lined with an endometrial layer that provides the tissue for implantation of a fertilized egg that turns into a zygote and later an embryo and still later a fetus. If no egg is fertilized, the endometrium sheds each month, called menstruation. This begins another cycle which must be triggered by the release of hormones from the pituitary in the brain. The fallopian tubes are paired organs on either side of the uterus and provide a connecting pathway from the ovaries to the uterus. At the time of ovulation, the egg is released and the fimbriated finger-like end of the tube sweeps over the ovary to collect the egg. There are cilia in the inner part of the tubes that further push down the egg into the fallopian tube. Most fertilization takes place in the fallopian tube and, after that, the fertilized egg travels to the uterus where it implants. If there is no fertilization, the egg degenerates and is absorbed into the body and menstruation begins. The zygote, the fertilized egg, will divide multiple times in the fallopian tube, but it won't increase much in size. When it reaches the blastocyst stage, in which the embryo is a fluid-filled ball, it arrives at the opening between the fallopian tube and the uterus and implants somewhere in the upper uterus. The ovaries are also paired organs on either side of the uterus. The ovaries have two functions: the periodic release of eggs and the production of sexual hormones, estradiol, progesterone, and androgens. It is the cyclic action of these hormones on the rest of the female reproductive tract that causes the ovulation and the menstrual cycle to occur. At the time of ovulation, the egg is released from a mature follicle or cyst on one of the ovaries called the dominant follicle. The follicle is quickly sealed, forming a corpus luteum, which produces progesterone to prepare the endometrium in the case of a fertilization and pregnancy. It also supports the zygote if the egg is fertilized. If there is no fertilization, the corpus luteum degenerates and transforms into a corpus albicans. This results in menses and the next cycle when new follicles develop in response to follicle stimulating hormone, or FSH, from the pituitary. These follicles make estrogen, which causes the uterine lining to build up and trigger the release of luteinizing hormone, or LH, by the pituitary. LH triggers egg release from the follicle, ovulation. The external reproductive tract organs are collectively called the vulva. These are mainly sexual organs that contribute to the female's sexual response. The clitoris is a highly sensitive erectile mass of tissue just anterior to and superior to the vaginal opening. It is the main organ of sexual arousal in the female. The labia minora and labia majora are the lips on either side of the vaginal opening. The labia majora are bigger and enclose the labia minora, which are the innermost tissues near the opening of the vagina. The opening of the vagina is known as the introitus. The area from the introitus to the rectum is called the perineum. Near the vaginal opening is the female urethra, just below the clitoris, and the Bartholin glands on both sides, which are glands that secrete mucus to lubricate. The mons pubis is the large, fatty, hair-covered mass of tissue anterior to all of the other reproductive organs and overlies the pubic bone. The menstrual cycles are the recurrent changes that happen approximately every 28 days to females and begins at menarche, which initiates at 12 years of age on average, until menopause. The purpose of the menstrual cycle is to prepare the female body for possible pregnancy resulting from the fertilization of the egg. It is constituted by three phases: the menstrual phase, the proliferative phase, and the secretory phase. The menstrual cycle starts with the menstrual phase, when the endometrium sheds. Then the proliferative phase begins. During this phase, the estrogen levels rise and the endometrial lining thickens. This is designed to make the lining a good cushion for the implantation of the embryo. The progesterone level is low during this phase. The FSH level rises in order to stimulate follicles to develop in the ovaries. Eventually, only one or sometimes two follicles are dominant and mature completely, with the other follicles regressing as described above. Close to the 14th day of the cycle, which begins on the first day of menstrual bleeding, the luteinizing hormone, LH, level increases sharply. This hormone comes from the pituitary gland, and its increase is referred to as the LH surge. It triggers ovulation, and the egg is released from the dominant follicle. The woman will have a clear vaginal discharge, like raw egg white, that helps the sperm travel better through the cervix to the inside of the uterus and the fallopian tubes. The third part of the menstrual cycle lasts exactly 14 days and is the secretory phase, or luteal phase. It is the time when the uterine lining matures and doesn't get any thicker. It becomes ready to allow the implantation of the blastocyst. The maturation happens as a result of the corpus luteum secreting progesterone and causing the secretory transformation of the uterine lining. If no egg is fertilized, the corpus luteum degenerates, progesterone and estrogen levels drop, precipitating vaginal bleeding, which is when the menstrual phase begins initiating a new cycle. If the egg is fertilized, its implantation and production of human chorionic gonadotropin, or HCG, comes from the human placenta. The corpus luteum supports the early placenta with progesterone until it can start a healthy pregnancy on its own. The menstrual cycle is repeated from the menarche at around 12 years of age to menopause at about 51 years of age. The woman will begin to have menstrual irregularity several years before menopause and may have symptoms such as hot flashes, night sweats, mood difficulties, and insomnia. Menopause is defined as the time after which a woman has not had any vaginal bleeding for a full 12 consecutive months.